My name is Sami. I have been a dentist for 20 years now.
My name's David and I'm currently studying second year at the University of Melbourne studying dentistry.
My name is Wally and I've been practicing in private practice for about 30 years and I've enjoyed dentistry.
My job as a dentist, it's providing dental services to everyone regardless of their background. In this setting it will be intellectual disability.
All Australians should be aware of the dental services available and be able to access them.
Inclusion in oral health care means provision of oral health services without discrimination.
Well, people with a disability are at a disadvantage when it comes to oral care.
Some dentists may see intellectual disability itself, it's a barrier already. They may perceive that people with intellectual disability has more complex dental health needs and they may shy away from treating them already.
It can actually take a bit more time to get a message across to somebody with an intellectual disability, but really that applies to a lot of the patients we see. Everybody's different and have different needs.
You know, dental services in Australia especially is very expensive. With limited finances, they may not be able to bear the cost of seeing a dentist regularly.
And some may be socially isolated, so may not know where to turn to when they need dental care.
I think communication is very important when we are treating especially people with intellectual disability. Coordination with all the healthcare providers and healthcare supporters is very important to help to give them a positive experience in the dental surgery.
There's usually a support person that comes with the person with the intellectual disability. It's important that we actually make use of that person. They can provide assurance, they can make the person more comfortable. It's important that they keep making the person aware that there's somebody there that they're familiar with. Communication
with the patients themselves is important as well. Using different visual aids like pictures, models may help them to understand what they need to do at home.
Dentists may need to change their treatment practices. They may need to explain things more clearly. They may need to be more generous with their time.
It's important that we take the time with anybody who's anxious. Every patient has got their own preferences. They've got their own way they like to be treated.
Being flexible and innovative with dental practice will definitely help to tailor the needs of the patient while they're in the dental chair, and that will of course improve their treatment outcome as well.
If somebody with an intellectual disability is given the opportunity to understand why these things need to be done and being given a role in helping in the practice, then they can then carry this on in their own private homes. Often when they're treated by a health professional, they're assumed that they need something special, they need special care. I think special needs dentists have got a definite place in private practice or in general practice. I've referred to special needs dentists in the past.
Special needs dentists are specialists who are trained specially to see patients with very complex medical history or very complex needs.
I've had patients that are nervous, even phobic. I've had very young patients, and even some patients I just couldn't treat for one reason or another. But to be honest, I've never actually had to refer a patient with an intellectual disability.
Normally with patients with intellectual disability, their needs doesn't categorize in that area. So normal general dentist is more than sufficient to provide the care that they need.
I've always thought it was important to try to treat the patient first. And various skills and techniques I've been able to apply over the years that I've learnt, which I've found work. And I've found that patients with a disability, if we talk to them, we take our time, we get to know what they want like any other patient, I found that treating them isn't really as difficult as what it might have appeared in the first place.